Morphine Sulfate ER Tablet, extended release is a medication used to help relieve severe ongoing pain, such as pain due to cancer. It belongs to a class of drugs known as opioid analgesics, and it works in the brain to change how your body feels and responds to pain. The higher strengths of this drug, 100 milligrams or more per tablet, should be used only if you have been regularly taking moderate to large amounts of opioid pain medications. These strengths may cause overdose, and even death, if taken by a person who has not been regularly taking opioids. It's important to note that the extended-release form of morphine should not be used to relieve mild pain or pain that will go away in a few days. This medication is not for occasional or as-needed use. It's crucial to talk to your healthcare provider about the best time to take this medication and the appropriate daily dosage for your specific condition. Make sure to read the medication guide provided by your pharmacist before you start using morphine and every time you get a refill. Take this medication on a regular schedule as directed by your doctor, not just when you have sudden pain. Your doctor will tell you whether to take it every 8 or 12 hours, with or without food. Swallow the tablets whole and do not break, crush, chew, or dissolve them. The dosage is based on your medical condition and response to treatment, so do not change it without consulting your doctor. Also, talk to your doctor or pharmacist about using morphine safely with other drugs. Suddenly stopping this medication may cause withdrawal symptoms, so your doctor may lower your dose slowly to prevent this. If you have been using this medication for a long time and it doesn't seem to work as well, talk to your doctor. And finally, tell your doctor if your pain does not get better or gets worse. Some common side effects of morphine sulfate ER tablet, extended release may include nausea, vomiting, constipation, sweating, lightheadedness, dizziness, or drowsiness. These side effects may lessen over time, but if they persist or worsen, it's important to notify your doctor or pharmacist. To help prevent constipation, it's recommended to consume dietary fiber, drink plenty of water, and exercise. You may also need to take a laxative, so be sure to consult your pharmacist for the right type. To minimize the risk of dizziness and lightheadedness, remember to rise slowly when getting up from a sitting or lying position. Additionally, you may notice an empty tablet shell in your stool, but this is harmless as the medication has already been absorbed by your body. It's crucial to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. However, if you experience any serious side effects such as interrupted breathing during sleep, mental/mood changes, severe stomach/abdominal pain, difficulty urinating, or signs of adrenal gland issues, it's important to inform your doctor immediately. In the case of very serious side effects like fainting, seizures, slow/shallow breathing, severe drowsiness, or signs of a severe allergic reaction, seek medical help right away. And as always, if you notice any other effects not mentioned, be sure to contact your doctor or pharmacist. Morphine Sulfate ER Tablet, extended release is a medication that is used to treat severe pain. It is important to take the smallest effective dose for the shortest possible time to lower the risk of abuse and addiction. It may cause severe breathing problems, especially when starting the medication or after a dose increase. It is important to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking this medication. Do not break, crush, chew, or dissolve this medication, as it could cause a fatal overdose. Keep it in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, seek medical help immediately. Women of childbearing age should talk to their doctor about the risks and benefits before using this medication, especially if pregnant or planning to become pregnant. Using this medication for a long time or in high doses near the expected delivery date may harm the unborn baby. If used for a long time, babies born to mothers who use this drug may develop severe withdrawal symptoms. It is important to inform the doctor if any symptoms are noticed in the newborn baby. Before taking morphine, make sure to inform your doctor if you are allergic to it or other opioid pain medications. It's important to discuss any allergies with your pharmacist as well. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a personal or family history of substance use disorder. It's also important to discuss any stomach/intestinal problems, difficulty urinating, disease of the pancreas, or gallbladder disease. This drug may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or anything that requires alertness until you can do so safely. It's also important to avoid alcoholic beverages and discuss marijuana use with your doctor. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, this medication should only be used when clearly needed and after discussing the risks and benefits with your doctor. It's important to be cautious if you are breastfeeding, as this drug can pass into breast milk and have undesirable effects on a nursing infant. Always consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that could affect the way your medications work or increase your risk for serious side effects. This includes both prescription and non-prescription medications, as well as herbal products. Always keep a list of all the products you use and share it with your doctor and pharmacist before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Morphine Sulfate ER Tablet, extended release include certain pain medications, naltrexone, and samidorphan. The risk of serious side effects, such as slow/shallow breathing or severe drowsiness/dizziness, may be increased if this medication is taken with other products that can also cause drowsiness or breathing problems. This includes other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Always check the labels on all your medicines to see if they contain ingredients that may cause drowsiness, and ask your pharmacist about using those products safely. Additionally, this medication may interfere with certain lab tests, possibly causing false results. Make sure to inform lab personnel and all your doctors that you are using Morphine Sulfate ER Tablet, extended release. If someone has taken too much morphine sulfate ER and has serious symptoms such as passing out or trouble breathing, give them naloxone if available, then call 911. If the person is awake and has no symptoms, call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, slow heartbeat, and coma. It's important not to share this medication with others, as it is against the law. This medication has been prescribed specifically for your current condition, so it should not be used later for another condition unless directed by your doctor. If a different medication is needed for a different condition, your doctor will provide the necessary guidance. If you forget to take a dose of Morphine Sulfate ER Tablet, extended release, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Morphine Sulfate ER Tablet, extended release, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a safe place that's out of reach for children and pets. Also, don't flush this medication down the toilet or pour it into a drain, unless specifically instructed to do so. When it's expired or you no longer need it, make sure to properly dispose of it. You can find more details in the medication guide, or consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.